Hello, Don here. Welcome to Podiatry Practice Mastery. We're helping your practice get to the $2 million mark and beyond. I'm doing this next where I'm looking at my $1 million practice formula. And I'm looking at chapter 15 here. I'm going to go through it. If you're watching this on YouTube, you'll be able to see a video. If not, you'll just hear the audio. But I'm going to go through chapter 15 here, how to increase patient flow without burning out. So when you're working on patient flow, I have a lot of doctors that reach out to me and they think they just need more patients. And sometimes they do, but for the majority, they just need better patients. So I'm going to explain that. I think for patient flow, if you have too many patients all the time, let's say you're around 30 to 40 patients a day, and it's probably going to be a lot of nail care unless you're very good at using associate, like other people to help see patients, like a physician's assistant that can actually do meaningful, profitable work. It's going to kind of burn you out. So I find number one is to develop a niche, some type of thing that you are better at than other people. Might be wound care. In my case, I like sports medicine, and that's the first thing is developing an authority. So seeing more of those patients tends to be more valuable for your practice. Number two would be learning how to ask for referrals, both from primary care doctors, but also from the patients that come in. So that's a pretty easy ask, and I can kind of give you some tips on how to do that. And then having some creative touch points or ways to kind of wow the patients. One that I like to do is when I do surgery, I give them a little post-op gift bag with some popcorn in there and a little referral card. Every time someone gets a orthotic or something that's higher value, they get a little gift bag here with some goodies that we have in the office, such as a water bottle and a little referral card asking them for referrals because we want to get referrals from those same types of patients. So many doctors believe that the solution to practice growth is simply more marketing, more ads, social media, more promotions. But what I've learned is that the best marketing for a medical practice is education-based marketing. Now, I didn't think about this idea. This idea came up from Dan Kennedy. If you've followed any of Dan Kennedy stuff, he talks about education-based marketing. And when patients understand that you solve a problem they're concerned about, they're going to seek you out. So they need to know that you solve the problem. There's the typical scenario we hear of a patient that you've been seeing for years that is being seen for nail care, and then all of a sudden they fracture their foot or they have some other issue and they go to an urgent care or you go to see another podiatrist because they didn't think that you did that. So we have an obligation to let patients know what we treat. One of the best ways that we found here is we send out a weekly newsletter. We talk about different things that we treat, show pictures, things like that. So a weekly e-newsletter is pretty inexpensive and it helps them to see that. I have a colleague that does a lot of surgery, and he kind of explains when he does routine care for patients, he says, I kind of only do this a half day a week, but most of the time I'm doing surgery. So he kind of plants that seed in the patient's head. So what are some of the sources for this patient flow? In our practice, new patients often come from several sources. Lately, I guess number one would be physician referrals. So the way we get those is we just send them referral letters, call them when there's urgent issues, and we just do a good job. And we go out to kind of meet the ones that we're not getting. This is an area I want to be clear. I'm not doing the best. I would love to do better. I really would like a practice rep to go out and kind of cultivate new referral sources because many just kind of refer to whoever is available. They don't have a name they're referring to. So I think this is some low-hanging fruit in our practice. And I like to explain kind of what's working for us and what's not working for us. Online reviews, this is a good one that's working for us. So we have about 1,200 reviews, and we have a system for that. We use Swell. There's a lot of other systems that you could use. I think the more manual ones, like asking patients, can be a little bit more of a challenge. I think the automated ones work a little bit better. But if you have 1,200 reviews and the other doctor has 20 in the community or their other practice, they're probably going to see you. Next would be patient referrals. Let them know that what you do. Asking patients for referrals. So the good patients, meaning the ones that spend more money with us, they get a little card. We have a little postcard that we give out that says about our podiatry urgent care. It talks about friends referring friends. Once again, if you want a copy of those, shoot me an email, don@podiatrypracticemastery.com. I'd happy to send you a copy on Canva where we made them. You can just edit them. Online education. This is something that I really like to do. You can do YouTube and then you can repurpose, meaning you can create content in one format and send it to other formats. I use something called repurpose.io. It's a method of repurposing content, and to make the content, I use Submagic, Submagic, Submagic. It's just a way to create shorts. You can take a long like this and cut it into little shorts and make more content that way. And then community presentations. This is something I would enjoy doing more of. I would hope my practice rep would help me to do this more, but getting those booked and being out of the office sometimes isn't the best use of time. So each of these channels will help build around trust. So I'm going to give you a simple strategy to educate or to teach referring doctors, giving a short talk. So once again, I think the hardest part is having someone set this up. I would love it if there was a way that AI could help me with this, but kind of reaching out to clinics and getting them to set up about heel pain treatments or about diabetic foot and prevention or fungal nail options. These are going to increase relationships and referrals. I think maybe this could be done with like an automated email sequence if we had someone's email there, and then we could just do that until a meet and greet is set up or a lunch and learn. One thing that I find works well is that when we do these talks or any talk, I record them and I put them on YouTube. So for example, I did one for a recent physical therapy place on plantar fasciitis. And then I sent out a copy to all my patients afterwards so they know that I'm doing these. We have a couple of webinars that are really evergreen and they're sitting on our website that patients they can continually download and look at and they can learn from them. So, and we can give them out to our patients. So it really, really helps with patient education material. My early mistake is that in the beginning, um, I tried traditional advertising like Google AdWords and things like that. It tended to be a little expensive. I wasn't that good at it. I'm not saying it doesn't work. I'm just saying I didn't know how to do it. And it didn't really build long-term relationships. I tried also sending out like a monthly newsletter to all the primary care doctors. I didn't really see much fruit from that. But I discovered that education works best. And it's something that I think most of us were doing that all day. People put trust in doctors that they put trust in doctors who teach, and you can use that once, produce it, record it, and then send it to your other patients. One of my best tips for doctors that say they don't like to record content is I recommend having a medical assistant follow you for a day and record you when you're explaining things to patients. I tend to find that when when we're in front of a patient, we do a really good job. So tasking this with a staff and maybe giving a signal when you're going to explain something and just say, hey, would you mind if my staff records this? So this will make you better and it'll give you content that you can use other times. So I guess some action steps from this chapter would be to identify physicians who refer patients to your practice, offer an educational presentation, and then share useful content with patients and to other colleagues once you record it. I've we've done, like I said, we've done a number of webinars. The hard part about doing webinars, in my experience, was getting the four doctors in our practice all together at the same time in an evening. But I found that like a 6 hour, 6 to 7 o'clock was a good time. We divided the presentation by four docs and we just did Zoom. And so we send out an invitation. We had 50 or 60 patients there, so it was a good turnout. Getting into primary cares and seeing them is kind of a challenge because everyone's busy. But I think it's something that's important. I think there would be a benefit of that. So next we're going to go over, I'm just going to go over to the next chapter and talk about associate doctors. So this would be the $1 million associate doctor. One of the most common questions I receive is how can I get my associate busier? I think there are two questions about an associate. One is getting them busier, and the other one is getting them profitable. Just having a busy associate doing something they don't like, if you throw all the routine care at them, for example, they're not going to like that. They're probably not going to stick around. You want them to be busy and you also want them to be profitable. Sometimes the associate produces half as much as the owner or even less than half. Sometimes they struggle to recommend treatments. I know many times they're not confident of offering high ticket treatments, or they may have just fall back on what they learned in residency and what the attendings did. And many times they may not be very business savvy doctors that they were working with. They don't understand how the practice works. And sometimes that makes us as owners, we can be frustrated. But after working with many practices, I've learned something that's important, that most associate doctors are not failing. They're simply never taught how a successful practice actually works. It's not really a lack of knowledge, because all the residents coming out are very knowledgeable about foot and ankle surgery, but a lot of times they're not knowledgeable about patient education and protocols and things like that, different frameworks. So with the associate training problem, so residencies, they teach doctors how to diagnose, how to do surgery, look at pathology, wound care, but they don't teach treatment presentation, patient education, practice systems, and then revenue awareness. And so the new doctors, when they enter into private practice, they often operate like technicians rather than leaders of the patient visit, meaning a lot of times we'll hear the doctors say, oh, we could do this, or you should do this, or this might be okay. We could try this. Patients don't want to try things. They want to be led by the doctor. So they don't really diagnose the problem. They recommend something small because they want a little commitment. They're concerned about offering things that are expensive, and then the visit ends and they really don't get great results. The patients get upset, lower treatment acceptance, and then lower production. So here are just my suggestions for some skills that every $1 million doctor uses. If you can master these 3 skills, I think it's going to help you out. Diagnosis. I think diagnosis is easy for most of us. You have to make the diagnosis of what they have. Sometimes it can be confusing, but for the most part, we can make the diagnosis. 2 would be patient education. You can do this any number of ways. I used to do a lot of things called patient presentations. So if you want to go to patientpresentations.com, you can look at mine. It's a PowerPoint slide that I made for each condition. And in those conditions, I was able to talk about all of the treatment options. It got a little bulky, meaning it was too many slides. And so I've kind of thinned out some of the slides. But I think educating the patient or teaching them about what's going on first, and then offering them a treatment plan. And this isn't just, oh, let's try this. It's like, okay, this is what we're going to do phase 1, and this is what we're going to do phase 2. So most associates are trained well, but they're not really good at the education and the planning. Okay, this is where we have a good opportunity when we're working with this new associate. So the education gap. So when associates hesitate to recommend treatments, it's not because they lack knowledge, it's because they don't want to come off as salesy. And so to default, they do minimal treatment plans. They try one thing, then they try another thing, then they try another thing. Like you can try stretching, you can try better shoes, you can try something on Amazon, and then they keep coming back if it doesn't improve. So this approach often leaves patients confused and it slows recovery. The truth is that patients usually appreciate clear recommendations, that they came for guidance. So we have to teach the associates how to do this. To help every associate succeed, there's a little simple structure that I recommend. Every patient visit should include these 5 steps. So clear diagnosis. So Mrs. Jones, you have plantar fasciitis and you have equinus. Plantar fasciitis is due to the tightness in the back of the calf. Over time, it makes the fascia thickened. Okay. And I'm going to offer you the best treatment. The best treatment is shockwave. Okay. And because on your ultrasound it showed little tears, the best treatment is an amniotic injection. And then to prevent it from coming back, the best treatment is orthotics. Okay. But sometimes this isn't covered by insurance, so certain patients want to try other things first. So I planted the seed about those treatments, and then I'm going to talk about, but today we're going to start with some basic things. We're going to start with some anti-inflammatories, icing, contrast baths, foam rolling, morning stretch, night splint, new shoes, UFOs, things like that. That's the immediate treatment. We're going to get you out of pain. If we're not getting better in 2 to 3 weeks, then we're going to do an ultrasound to go to the next step. Okay, that's how I explain it. So they know the timeline to recovery. They know immediate treatment that we're going to start that day. Patients love it when you say, hey, let me check and see if we can get you into shockwave today. If they've tried other things before, if they just want to jump to it. And a lot of times the patients, they just want to jump to what works. You can do the same thing with shockwave. You can do the same thing with Swift. You can do the same thing with other types of treatments. When the associate follows the framework, their visits become more consistent. Patients understand the plan and treatment acceptance improves. So I'm going to talk about my own mistakes. When we first hired associates, I assumed that they would naturally adopt the systems that I used. And sometimes they did. Most of the time they didn't. And a lot of them, I had one that was just trying to get in and out of the room and really didn't produce anything in terms of revenue. Not because they were incapable, because it was my fault. I didn't really teach them how to use the systems. We just hope that they'll get it through osmosis. And some of them, if they're motivated, they will shadow you and kind of learn to do what you do. But once again, most people fall back on what's easiest until they get a little kick behind them in terms of looking at their production. So here's my recommendations for an associate training system. So every associate must learn several key tools. that we've talked about all throughout in this book, okay? First would be explaining the best treatments. So even if they're not going to do the best treatments the first visit, you're going to talk about the best treatments, okay? And some patients, they just want to do what's best and they want to do what's quickest. Second would be using treatment sheets, using those sheets, having it written on there, giving it to the patient, checking what they're going to do first visit versus second visit, using scripts. So you have to train scripting. And in this, doctors, we tend to get better at this over time. But like my favorite thing would be you recording yourself with a patient and then reviewing it with one of the other doctors and or just listening to it yourself. And then you have to assess their per visit value, like how much are they producing compared to the other doctors? Are they producing fine, so they just need more patients, or is it just they're not producing? So these can give the associate confidence. They don't need to improvise explanations. You just have to follow a system. And the same thing with when we're learning surgery, when you're learning from another doctor, just do what they want you to do, and that'll make them happy. And then in the future, you can improvise, but you have to learn the basics first. So here's a practical training exercise. I'm not the best at this, okay? We're still kind of learning this in our practice as well, but here's a few suggestions. Shadow. Have an associate in their downtime or initially when they're starting, shadow a couple of days a week, more experienced doctors, so they can learn how to explain conditions and write down notes, kind of how they think they could do it. Review cases at the end of the day, have them pick a couple of cases that are more profitable and talked about, like, how did you provide valuable treatment for them? Go over the diagnosis, the treatment plan, the outcome, any struggles that they had, why patients didn't accept their recommendations. And this will build awareness and help them to get more opportunities for treatments. It also helps to discuss which patients didn't accept. So I think a lot of times we learn more from those that didn't accept it than those that did accept it. And then do role playing. Ask the associate to present a condition or record the condition, listen to them, see where they're hesitant or confused, and give them feedback. There was a doctor I was helping recently. He was from Canada and he had shockwave. He had radial and focused, and he was charging 125, I think, per treatment. And he was only offering 3 treatments. And he was very wishy-washy. Like, we could try this. And I said, no, you've invested almost $100,000 in these machines. You should be charging at least $250 a session, and you should do 6 of them. And he just wasn't confident. I said, do you believe it works? I said, yes. Well, just offer it to patients. And the patients started to accept all 6, and he's doing much better. It's just having a little role playing. So once again, if you want to role play with me, let me know. Do my practice audit. If you haven't done that, go to podiatrypracticemastery.com/audit. In there, I'll go through me, and then I can meet with you about your practice and give you some tips, and you can do more coaching if you want. But just try that. I'd be happy to. I would start with the audit, okay, and then record and have them explain how they explain things, and listen to them and give them feedback. So I'd certainly be happy to do this. If you do the audit, you could send me an audio, and I'd be happy to give you some feedback, okay? So the goal isn't to push procedures, okay? The goal is to help an associate to deliver complete treatment plans. And when they do that, the patients recover faster, the associate becomes more confident, and the practice grows. The surprising result is that something interesting happens when the associate learns these systems. They become better at their job, and the job becomes easier. They stop improvising, they follow the structured visits, and they get more confident. And this a lot of times takes a time for a doctor to get confident, both with surgery, we know, but also with treating in the clinic. A lot of times we're trained in our residencies only to do surgery, and we're very confident to do surgery. We're just not confident talking to patients and talking about out-of-pocket expenses. So if you have an associate doctor, I would recommend teaching them the $1 Million Visit framework, provide treatment sheets for the common diagnoses, and review most valuable treatment cases weekly. Review with them. Say, hey, once a day, hey, what's the most valuable patient of the day? Show me what worked for you. And so you can work on these. And these small changes can really help an associate's production. So if you like this audio, you can certainly download the book at podiatrypracticemastery.com/book. And we are going to go to the next chapter very soon.